What is intermittent fasting? Intermittent fasting is a dietary pattern where you cycle between periods of eating and periods of fasting. This eating pattern doesn't specify which foods you should eat, but rather when you should eat them. Benefits of intermittent fasting. Weight loss. Intermittent fasting can help you lose weight by reducing calorie intake and increasing fat burning. It may also help prevent the loss of muscle mass that often occurs with weight loss. Improved metabolic health. Intermittent fasting can improve insulin sensitivity, which may lower the risk of type 2 diabetes. It may also lower blood sugar, blood pressure, and cholesterol levels. Reduced inflammation. Intermittent fasting has been shown to reduce inflammation, which is linked to many chronic diseases, including heart disease and cancer. Improved brain function. Intermittent fasting may improve brain function by increasing the production of brain-derived neurotrophic factor, BDNF, a protein that is important for learning and memory. Anti-aging effects. Some studies have suggested that intermittent fasting may have anti-aging effects by reducing oxidative stress and inflammation. Reduced risk of chronic diseases. Intermittent fasting may reduce the risk of several chronic diseases, including heart disease, cancer, and Alzheimer's disease. How to do intermittent fasting. There are several different ways to practice intermittent fasting, but the most common approaches are: time-restricted feeding. This method involves restricting your daily eating window to a certain number of hours, typically between 4 and 10 hours, and fasting for the remaining hours. For example, you might eat all your meals between 12 p.m. and 8 p.m. and fast for the remaining 16 hours. Alternate day fasting. This method involves alternating between days of normal eating and days of either total fasting or severe calorie restriction. 5-2 diet. This method involves eating normally for 5 days of the week and restricting calorie intake to 500 to 600 calories for 2 non-consecutive days. Impact of intermittent fasting on kidney health. There is some evidence to suggest that intermittent fasting may have a positive impact on kidney health. Studies in animal models have shown that intermittent fasting can reduce the risk of kidney damage caused by diabetes and high blood pressure. In human studies, intermittent fasting has been shown to improve several markers of kidney health, including glomerular filtration rate, GFR, which is a measure of kidney function, and urinary albumin excretion, which is a marker of kidney damage. However, it's important to note that there is limited research on long-term effects of intermittent fasting on kidney health, especially in people with pre-existing kidney disease. Some studies have suggested that intermittent fasting may increase the risk of dehydration and electrolyte imbalances, which could potentially harm kidney function. Therefore, it's important to talk to a healthcare professional before starting any new diet or fasting program, especially if you have pre-existing kidney disease or other medical conditions. If you like the video, please subscribe and press the bell button for more interesting videos.